welcome everyone. My name is Ala Alawaisi. I'm Director for Clinical Operations and Engagement at Qatar University. And we are delighted to be hosting this interprofessional global cafe. And I'm very excited about our two presenters presenting today and sharing some contributions from the region, from the Middle East. So without further ado, I'm going to introduce our first speaker, Dr. Siva Ramakrishnan, a lecturer in the University of Sharjah. She is a lecturer in the physiotherapy program with specialization in women's health physiotherapy. Her research interest is in vital capacity, patient education and safety, academic integrity, simulation in healthcare, and inclusive and sustainable education. She received her MPT in obstetric and gynecology from the UK, Master of Physiotherapy in obstetric and gynecology from India, and Bachelor of Physiotherapy from India. In addition to postgraduate diploma in health profession education in 2015 from Gulf Medical University in United Arab Emirates, and postgraduate certificate in academic practice in 2022 from University of Liverpool in the UK. So we are very excited about having you with us, Dr. Siva. You have 15 minutes, and then we will have the presentation with Dr. Iman, and then it will be time for a question. So the floor is yours, Dr. Siva.
Thank you, Dr. Ela, for your warm introduction, and greetings and good evening from UAE. Today, what I'm going to discuss is about the study protocol, which we have started, and it's going successfully in the University of Sharjah. It's an interprofessional team approach to address the perception of health equity among health profession educators and students in the United Arab Emirates. Specifically, we are focusing in the first stage in University of Sharjah. So the aim of our study is to assess the effect of the interprofessional team-based learning on the perception of health equity. And I'm going to discuss why did we focus on health equity, but this is a joint venture across all the programs from the medical campus, which includes close to 8 programs from the medical campus. And we have figured out in the investigators from each of the streams we have come together to assess a particular concept called health equity from the educators and as well as the students. So why did we choose this particular topic of health equity? Number one, health equity is about how everyone receives the fair health care, irrespective of their gender, irrespective of their race, religion, and irrespective of the economy as well. But our worry was that are our students being educated about this in their curriculum or not? Like, do they have enough knowledge, or do they have enough idea about the region's health disparity or the equity or any kind of health inequity available in the United Arab Emirates? So what we had focused is about, like, let us first talk about the first stage of the study was addressing towards the health educators to get their perception about the curriculum itself, what they deliver. The curriculum involves, it could be physiotherapy, it could be nursing, it could be medicine or health service administration, clinical nutrition. In all these curriculums, we had decided to see to what extent the curriculum talks about health equity and how it can be promoted. And how we have decided to do this is in the form of the interprofessional learning. As the authors say, the learning arises from the interaction between the members, and it can happen spontaneously, or it can happen in a place which had been made to create this environment. So we had worked on a set of protocols to how to make this interprofessional learning on health equity can be possible to implement a certain set of impacts in the community. So as we did the search of evidences on the health equity and what we could do as a health professional, should we focus on this particular topic now? Is it really important to us? Yes, many of the evidences were focusing or directing us to focus on something called the health equity, which in turn leads to the sustainable form of education. The students, if they have to move towards sustainable form of education, they have to understand one of the main categories called as health equity. The other one is the social accountability. The other one is the inclusive process. So we had chosen this particular area of interest to explore in detail amongst the healthcare providers and also the students. And also we wanted to, in this process, we have decided to see the curriculum, how well it can fit into the process of addressing the aspects of health equity. So this research is funded. It still is active. It is funded by the University of Sharjah, by the Chancellor's Teaching Excellence and the Innovation Grant. And we had used a mixed method study design for our study protocol. We had chosen people from the physiotherapy department, the health educators, physiotherapy, nursing, medicine, dentistry, pharmacy, environmental health, lab sciences, clinical nutrition, and health service administration. So the study had introduced a validated questionnaire. The questionnaire had a set of 15 questions, which was prepared by the research team, and it has been validated, and it has been distributed across all students, irrespective of the year in which they study, with year 1, year 2, 3, 4, and 5th year for the MBBS students. So we had put it across all the programs, and we had asked the questions addressing towards how much what are the content do they study in the curriculum, so that to understand, like, is there any year of focus they speak about health equity, or there is any particular year where they don't talk about health equity at all, right from year 1. Followed by that, we have a focus group discussion where we discuss on 2 important themes. Here we invite the healthcare educators and as well as the health professional students to be part of the focus group discussions too, and we guide them through 2 important questions, and we ask them, like, what all the aspects to be identified in terms of health equity. So this is how we made a kind of an interprofessional team-based learning approach for the session. So the initial questionnaire, what we have developed for them, has been given in the form of an IRAT, where we give this across, and the questionnaires were distributed online, and we have the scores of all these students and the educators with us. And further, in the questionnaire itself, we have a column that would we like to be part of the focus group discussions, which has been scheduled in certain days. The ones who were giving the consent to participate, they've been invited. And when they have been invited, they have been divided into different teams. Each team will have a different professional, maybe one physiotherapist, a nursing student, a HSC student, a nutrition student. So we divided them into the teams. And once they divided into the teams, now the same questionnaire has been given to the students and the educators to fill in. So this leads to the TRAT of the team-based learning. And the applications questions, here we use the focus group discussion themes. The 2 important themes what we have in place has been discussed with them, and it was moderated by a moderator. And after we have been answered a set of questions, we went to the process of appeal in the team-based learning, where we can voice out the opinion about the queries with the students or the educators on their concern, on their roles and responsibilities. And also they can talk about the interprofessional collaboration effect and how it can affect the health equity in the region. Followed by that, the whole team, they had received a debriefing session on health equity, what is health equity, how it can cause an impact on their curriculum and how they have to perceive it in the future. So the questionnaire, an example question which was asked to the students is whether teaching and learning the subjects in the university addresses the importance of interprofessional learning approach in managing a patient. So the questionnaire had comprised of 2 aspects. One is health equity, the other one is the interprofessional learning. So it had got the 15 questions divided into this 3. So the students can either choose agree, disagree, or either they agree or not disagree, like they don't have an idea. This is an example of one of the questions given to them. Followed by that, we have a focus group guide for the team-based learning. And to let that, we had two different themes. One of the theme is the extent of health equity discussed in the curriculum for the students who has been chosen. And the second one is about the interprofessional learning as a method to promote health equity. So, for example, one of the topic which we had formulated is with explore the extent of health equity discussed in the curriculum. So we ask the educators and the student, what is your understanding of the health equity from the curriculum being taught? And we have the prompts which is being given by the moderator to the participants on how important is it for a health professional to understand health equity, and who is the health professional accountable to provide health equity, what methods your curriculum is using to address health equity. So we prompt these questions, and all these things are transcribed, and we are using the Zoom session. It is going to be an online session. Like, we're going to record these sessions, and all the things what has been discussed from the students will be transcribed using the verbatim software NVivo, which is used for mostly the qualitative studies. So what is the innovation and challenge which we are looking forward from this particular study is that when we use these kind of interprofessional team-based learning and the focus group discussions on health equity, we are preparing the future healthcare practitioners about what is health equity. Does it something like inequity prevails in this region? Is there something to address? Am I really be sure about how am I going to practice in this region if I have to practice? That is one of our main innovation, or one of the main challenge that we have to address these factors to our students before they graduate. And the second thing is to promote interprofessional education or the interprofessional learning, which is globally it is something of paramount importance to provide a patient-centered care. And how do we expose our undergraduate students to these kind of interprofessional learning experiences, so when they go out and learn with the peers, or when they work with the peers in the hospital setup or any other setup, they don't have the inhibitions to communicate with the other fraternity members. So the expected outcome of this particular protocol, what we had developed and running, is the health profession educators and the students, they will be aware about what is health equity. And this also promotes them to collaborate more with the healthcare team members to promote health equity in this region, and also to put something related to health equity in the curriculum for a betterment of the society itself. And also, when they have these form of interprofessional learning in their undergraduate curriculum, they are going to be a good interprofessional practitioners too. So the learning is leading to the practice. So the impact of what we think at the university level is it develops the culture of interprofessional collaboration among the healthcare professionals and educators and students in the university to improve the perception of health equity itself in the United Arab Emirates. And maybe if this project is running successfully, and if we get to know this health equity is which being addressed very less in the curriculum, we are even thinking about proposing health equities on among the interprofessional course to be included in the curriculum in the near future. And also this is to showcase that our university is going with the form of interprofessional education and collaboration, and we are in for it. And we show the university's commitment to the interprofessional collaborations. So this is our research team, and the research team, which includes my dear team members from different departments, and also I've recently got connected with the Devla from University of Limerick, and who is really we are working really well together on the focus group guides, and she has published many studies on the social accountability in medical education. So this is our research team whom we are working with. And thank you.
Thank you so much, Dr. Siva. This is a really great presentation on a very, very important topic. And, tackling it from an interprofessional perspective is really great. So thank you so much for this really great presentation. And we will have time for questions after Dr. Iman's presentation.
Yeah, thank you, Dr. Ella.
Thank you. Dr. Iman? So let me introduce Dr. Iman. Dr. Iman is the Assistant Dean of Assessment and Evaluation and an Assistant Professor of Medicinal Chemistry at the College of Pharmacy and Director of the Center of Interprofessional Education, Research and Practice at Gulf Medical University in United Arab Emirates. Dr. Iman is a highly accomplished academic who has extensive experience in medicinal chemistry and the health profession education. She earned her PhD in medicinal chemistry from Ain Shams University in Cairo, Egypt, and Georgia State University in Atlanta, Georgia in USA in May 2017. In addition to her PhD, Dr. Iman recently obtained a master's degree in health profession education from a joint program between Gulf Medical University and the Foundation for Advancement of International Medical Education and Research in the United States. Dr. Iman began her academic career at Gulf Medical University as an assistant professor of medicinal chemistry in the pharmaceutical science department. In 2019, she taught and mentored students in the PharmD and Master of Science in Drug Discovery and Development programs. And in February 2020 to 2022, she was appointed as the director of the Student Happiness Center at the College of Pharmacy at Gulf Medical University. During her tenure, she launched various student support programs, including the mentorship program, the Own Your Future Career Counseling Program, and the Together We Rise Peer-Assisted Learning Program. And in May 2022, she was appointed as the Assistant Dean of Assessment and Evaluation, supporting assessment practices at the College of Pharmacy. And she is the Director of the Center of Interprofessional Education since 2021. So very interesting, Dr. Iman, from being a scientist, medicinal chemistry into health profession education. So thank you so much for joining. Dr. Iman will, her title of presentation is she's going to be talking or sharing a framework for design, implementation, and evaluation of patient-centered interprofessional clinical training at Gulf Medical University. The mic is yours, Dr. Iman.
Thank you. Thank you very much, Dr. Ala, for this introduction. And it's really great honor to be with you here with the IPE experts in the region and in the region and in the global, on the global level. Can you see my screen? Just to double check and hear me well?
Yes. Yes, we can.
Great. So today I will be sharing reflections on about what we are doing at Gulf Medical University, the framework for designing, implementation, and evaluation patient-centered interprofessional clinical training at GMU, which actually this is my thesis project. But before I go to the details, I would like to take your introduction to the context. What GMU. We are here in GMU having what we call it Academic Healthcare Center at Gulf Medical University. So we'll have a journey or overview about the campus, the Academic Healthcare Center, how we are designing our IPE curriculum, general overview on our approaches in designing longitudinal IPE curriculum. And then I will take you in a brief journey about the research-wise, how we introduced or did an explorative study to introduce a patient-centered interprofessional clinical training at Gulf Medical University, the aim, theoretical framework, conceptual frameworks, and go through the method, briefly method results discussion, and so what's our future. So let's start with the journey here. So this is, we introduce you to the Academic Healthcare Center of Gulf Medical University, or the context that we have in UAE, Gulf Medical University. So Gulf Medical University is in United Arab Emirates and in specifically in Ajman. And in GMU, this is the campus, or the main university campus is actually when the students join in or enter the campus, it's only academic health programs. The university has various health professional programs such as dentistry, medicine, pharmacy, nursing program, health science, and recently we have the College for Health Management and Economics. So as the students enter the campus, they are in an interprofessional health professional environments. They have their classmates, colleagues, faculty in the college from different healthcare programs. there is a various of teaching methods, either in a clinical simulation and practicals lab, in a simulation lab, as you see, sciences lab, by various programs. In medicine, we have a shared simulation center, which we call it CASH Center, where all the students' programs are taking courses there. Of course, there is the hospital and the clinical training, where the students can go in the clinical rotations. So all these is the environments where all the healthcare programs are there in the same campus. And the GMU, or the Gulf Medical University, is part of Thumbay Med-City. And this is the campus where is the university, and these are the different hospitals where the students can have their rotation and they see their patients. So this is the Thumbay Dental Hospital, there is the Thumbay Physical Therapy and Rehabilitation Hospital, and the Thumbay University Hospital, the main hospital there. So as you see, it's 2 minutes distance where the academia with the practice is merged in one city. There is the hospitals, the clinics, the research center, the pharmacy, the daycares, and the research lab in one campus. And this journey has been actually progressing, or over the year. We started in 1998 with BBMS program, and then through the years, the hospital 2002, the hospitals was established, then growing the difference program, 2008 become the Gulf Medical University, and then various introduction of various programs in the university that we are proud also not only with the vision of the education. So we say this is the academic healthcare center with education integrated with the research facility and with the healthcares at the various system. And related to RTE in 2020, we established the Center of Interprofessional Education, Research and Practice at the university. So as you see, by facilities, by the environments, we have here a very strong interprofessional environment for not only for educating our students, but also for practicing in the different setup, where the students can have the opportunity to have clinical practices, lectures, whatever the type of learning environments is there, it's available. We don't have locations issue or proximity issue. It's there in the academic, in the mid-city, in the academic healthcare system. But all this is really bright and amazing, but we really need to think how the IPE or how the interprofessional learning is going to be organized. Because feeling of learning, if we don't have a solid mapping, alignment for our curriculum, having a concept of constructive alignment, what we are going to teach, what are the business methods we are planning to fail, even if we have all the resources really planned for the curriculum itself. And
Dr. Iman,
yes.
Dr. Iman, your voice is a little bit unclear.
Okay, so is this better now?
Yes, a bit better, yes.
Okay, so I was just mentioning that without the facilities only is not the way of providing a successful interprofessional learning. We need to have a constructive alignment, because if it's not there, we have a curriculum with a vision and with certain constructions. So we need to think, and that's why I'm sharing, and this also leads us to the study that we did. How we are organizing the program, what are the learning outcomes, IPE and interprofessional learning outcomes, what are the different content that we're going to teach, what is the education strategy, is it going to be lecture-based, team-based learning, is it PBL, simulation, what are the educational strategy, how we will assess the learners and how we evaluate the outcomes. It's a whole continuous story that we need to think about in order to design the IPE curriculum. So in the coming slide, I will be briefing or sharing the outline of the longitudinal IPE curriculum at GMU. Regarding the IPE competencies, we adopted the interprofessional collaborative competencies, and these competencies are structures in the 4 domains: values and ethics of interprofessional practice, the understanding the role of responsibility of collaborative practice, interprofessional communication and interprofessional teamwork, and team-based practice. So these are the main pillars of our programs, 4 domains, and as you see, while we go at the first year or the foundation year for the students in our program is we call it the exposure phase, where they are exposed to the different domain of interprofessional competencies in terms of they have a team-based simple lecturing or group activity where they start to learn about the different professions, values, and ethics, communicate with each other. The students are divided in interprofessional group with their facilitators. They also in semester to visit the Tombay University hospitals and the different hospital settings, communicate and engage with different healthcare professionals within interprofessional team, and knows and more about the different roles and responsibilities of the different healthcare professions. And this is the foundation year. In the pre-clinical years, or we have the immersion phase where the students start to do some sort of interprofessional activities, such as, for example, taking a shared training in vaccination between the different program here in the simulation center, interprofessional teams of students with different skilled care providers, interprofessional case discussion by different students from different programs. This is another approach. Or the interprofessional community engagement, where students with different programs go engage with the community, providing certain healthcare services. So these are the common IPE activities that is done at this phase for the students, captures through their e-portfolios and different reflections in their program. And the questions here, what we will do in the practice setting, we want interprofessional activity that that integrate the IPE with their clinical practice at their rotations or their closure. And this is actually the study that I will explain in the coming parts, in the coming time. So to evaluate that, also we are going with the Kirkpatrick model, where the students are filling self-evaluation surveys, reflections. So we're measuring level 1, their reactions. The acquisition of knowledge is done through some sort of very simple assessments, but not the focus. We are mainly focuses on the students' reactions. And also we want to have something in the clinical in order to go to a higher level, how they would behave, what's their attitudes, and we go beyond more to see the patients. Is this affecting the patients? What is the patient's reflections and perception about receiving an interprofessional care? So this takes us to the problem statements of the research or the gap. Different study we have been reported to ensure the positive impact on IPE on learner satisfaction, perception of knowledge gain, improvement in attitudes about other professions in the undergraduate students or pre-license, but still I have been seeing fewer on the effect on IPA on the students' behavior, practice, or patients, specifically in the complex here in the Middle East and the UAE. How to prepare our students or our healthcare professionals to their future role that they are practicing in the clinical setting in the hospital. And this is the setting, the patient-centered setting, how they will be providing what we see here in interprofessional care to our patients. So this is the study that I will talk about, is the explorative study we done. How did we introduce or try to introduce a patient-centered interprofessional clinical training at Gulf Medical University in the Tombay Hospital? We will go through the aim, the theoretical framework, conceptual framework, method, result, discussion, and then the conclusions for them. So the study aim was to measure the effectiveness of a patient-centered interprofessional clinical training program done at GMU. And we want to measure the change in the perception, the students' perception to attain IPE competencies and this level 2A in the Kirkpatrick model, and also the patient satisfaction, how the patients perceive this clinical care or interprofessional care, and this is at level 4B in Kirkpatrick topology. So the theoretical framework that it is the interprofessional framework where the patients will receive a care from 3 students from medicine, pharmacy, and nursing students. And during this visit, the students will be communicating with each other, and with the interprofessional patient collaboration will happen through in a patient-centered environment.
Sorry, Dr. Iman, we can't hear you. Your voice has gone.
Okay, so is this better?
It's still far away. It's a bit far.
You may want to try going down by the little microphone in the corner in changing your microphone input. So there's a little microphone on the bottom left. You can click on the up arrow and see if you can change your microphone input.
No, it's still fine. It was fine, but I don't know what happened.
Yeah, it kind of cuts in and out. It might be due to ambient noise.
So is this better now?
That's better.
Better,
Yes,
yeah.
yes, thank you.
This is better. Okay. So I was here about the theoretical framework, how the interprofessional learning will happen in these environments, in the patient-centered environment. So according to the model, we think that this is the framework or learning will be socially constructed while the students communicating with each other and the patients. And the community of practice theory will be applied in this model in addition to the experiential learning theory by Bob. And also a situational learning will happen by a situational learning theory in the hospital setting based on the patient that the students are facing and even the interventions and interactions with the patient. So as we go here, framework, conceptual framework for our study here, that we are moving from a traditional, comparing or moving from the traditional healthcare education model where the students alone segregated meet the patient, communicate with the patient isolated, and this will be reflected in their future role and in future practice as physicians, pharmacists, or nurse or healthcare professions that have limited collaboration in their practice setting. While in the IPE environments or the interprofessional patient-centered environment, the students expected to graduate or to work in when they learn in this collaborative learning environments will be practice ready when they start to go to their future practice. Regarding the method or the setting of the study was conducted in the dialysis unit at Tombay University Hospital in Ajman. 21 students participated in this training, 7 from each profession, medicine, pharmacy, nursing, and these students were divided into 7 interprofessional homogeneous groups where containing 1 student from each profession. So we have 7 interprofessional groups, and each one in each group was assigned to a patient. So I have 7 IPE groups, and each group will be assigned to 1 patient in the dialysis unit. These students met the patient at least 3 times or over 3 sessions with a specific objective that session 1, they will be establishing rapport, communicating, assess the patients, and discuss the patient's preferences and any concerns. Or session 2, they evaluate the patient plan. And session 3 is the closure and feedback for the patients. Regarding the assessment instruments used in the study, we applied the ICAS, the Interprofessional Competency Attained Surveys, pre and post to the study. In the described 6 domains, measuring interprofessional communications, collaborations, role and responsibilities, collaborative patient-centered care, team function, and conflict management. And this is a 20-item 7-point inter-scale survey. In the post survey, we added an open-ended question for the students to reflect on the effect of interprofessional clinical experience on their understanding of their own professional roles and responsibilities in patient care. And this assessment tool would measure level 2A according to the context model. This is how we measure the student perception. For the patients, we did patient satisfaction surveys, modified version from Survey Itan. It's divided 4 domains regarding the ICE or the interprofessional group supported supporting the patients relating to medication knowledge, self-management, empowerment, addressing concern for the patients, and general question regarding the patient. This is with a 5-point Likert scale, 14 items in this survey. And this is how we assess for the outcomes at level 4B according to the Kirkpatrick's topology. Regarding the results for quantitative analysis was done for the pre and post survey and the ICAS surveys, and we have been seeing significant difference in the all domains when we did the study. We used related samples Wilson sign bank, and in all the domain we received a significance difference with a little bit contribution, or just we realized that the conflict management may be a little bit less than the other, but still it is a significant difference. Regarding the patient satisfactions in the older domain, we received that the patient's positive, we measured the responses frequency, and the patient satisfaction was positive in all the domains. What was interesting, the qualitative analysis of the open-end question. We did thematic analysis, code-to-code analysis for these, the items or the questions regarding to the interprofessional communication, collaboration, role of responsibility, collaborative patient care, conflicts management, team function, integration of knowledge, future practices if the students have a positive or negative experience. And what's interesting that came in this part, that 50% of the students clearly mentioned that this experience has been positive for them, no negative comments has been seen, and the collaborative patient care domain, 47% of the students reported what's reflected that they have meaningful collaborative patient-centered care, or they were able to do that. What was interesting for me while doing the study, that I see items regarding integration of knowledge. This wasn't mentioned in the survey, in the survey, but the students during their feedback, they mentioned how they learn, or they were able to integrate the units, their learning at this level. So there was integrations of learning that happen at this higher level or at the clinical setting when they are doing that. So it's not only skills, knowledge, integration of learning has been going through. And one of the interesting statements that I will be sharing here regarding the role of patients of importance, or the role of patients in the interprofessional clinical training. So when the patients is there, and we said by the theory that learning will happen through social interaction between the students and patients, and the role of patients in history that it has been reported in some studies, it's something very important. As seen here in the students' reflection, I understand the role of multidisciplinary team in patient care. I learned communication more effectively with the team, identifying each other role in patient care. We were able to discuss about the patient care plan. So just this is one feedback from the students, and we have seen the strong impact on the patients in providing this learning opportunity. And this has been coherent with previous reported findings about the important role in the patients in the IPE, and also can correlate with our theoretical model, or the theoretical model of social construction of learning that happened with the interactions between the students and the patient, the theoretical framework of the patient-centered learning. We see it in the reflection. Regarding the integration of knowledge, it's clearly mentioned in the feedback. The experience was extremely enriching and knowledgeable. I got to learn a lot from my fellow colleagues. We shared the set of knowledge, okay, that helped me care of the patient. So although this is not clearly constructed or measured in the survey, we see that learning is socially constructed throughout the interactions between the students throughout all these learning theory that we see here. The second question regarding transferability of the interprofessional learning. Are these students going to have something that will be transferred? Would this clinical training affect their future practice? In here, the current study, it is done. The students are not graduating yet. It's done through when they are in the college yet, or their program yet. So we couldn't measure that. But the theoretical framework itself, that when we have experiential education and the students in clinical learning practice, would this be translated to a collaborative care when we do it interprofessionally in the experiential setting? We refer to the theory and the implication of the IPE, or experiential learning in general in IPE, and this was stated in the model that the fact if we use experiential learning, this has a lot of implication and possibility and transferability in the future. Furthermore, Helen et al. Reported that they did a follow-up study after doing IPE for 21 days, 3 weeks, and then re-measured that 2 years later, and they find that the IPE competency learned throughout this, clinical training was transferred to the students in their clinical practice based on the survey that they did and in their study, or based on their study. So we believe that this exposure during this clinical training would be or have impact or will be transferred to their future practice. To conclude our study, the setting itself, the experiential, to have experiential learning environments for the learner to collaborate as interprofessional team to provide a collaborative patient care. This was one of the positive settings, or a good setting that we can proceed in our clinical training. The learning was socially created through interaction between the students based on their surveys and the multiple assessment we did. We've seen a significant difference in students' perception of the IPE competency, and also from the patient perspective, the patient has a positive patient experience. The students learn to work collaboratively as interprofessional team. We expect that these students should expect to work collaboratively in the real clinical setting as they practice. So in other words, the study conceptualized and gives evidence for the theme we are all know the definition we're learning. The students in the interprofessional learning has the opportunity to learn with, from, and about each other, and they are learning together through working together. The study has limitation for the number of the students, but this is the number of the students, all the cohorts, specifically nursing program, that were doing their rotation in the final year of this year, last year when we did the study. The complex study was one-on-one complex in the GMU academic healthcare system. The traceability to another complex or culture is something we didn't measure. We want to expand to study the outcomes to including the effect of RPE in healthcare outcomes, like how this is affecting the healthcare outcomes of the patients. We measured the perception so far. The impact of RPE on the future practice, we couldn't measure, as I mentioned, for the study period, but hopefully later on we can redo the survey and take or measure this effect after the students reach the practice. The future research for this area would be how to measure the clinical outcomes, or measure the clinical outcome of IPE on patients' care, the role of facilitator or the clinical tutor for successful implementation for IPE interprofessional education, the pattern of clinical reasoning or diagnostic decision among the medical, pharmacy, and nursing students. Also, this is a future scope for research we'd like to investigate. And as I mentioned, transferability and long-term impact of interprofessional clinical training experience reflecting on a future practice of the students. And here I would like to acknowledge all the teams, the supervisors in the project, Professor Hassan, Professor Taylor, my master supervisors, the deans from the different colleges, pharmacy, medicine, Professor Manda, Professor Silva, Professor Sharif from pharmacy, Professor Manda in College of Medicine, and Professor Silva, the clinical facilitators and the clinical experience facilitators and Associate Dean, Dr. Dixon, Dr. from pharmacy, Dr. Sayed from medicine, Dr. Mary from medicine, and Dr. Rajuman, who's the chef head of the Tombay dialysis unit, who supported us as a physician in the study and overseeing the whole clinical training. Thank you all. This is the end for my presentation here, and I will be happy to start the discussion with Dr. Selva. Thank you.
Yeah, thank you so much, Dr. Iman, for sharing your experiences in introducing clinical IPE into clinical placement, which I know is quite challenging and it's not easy. So well done for trying this. And this was really a very interesting project, and congratulations on completing your master's in health profession education with a specific focus on IPE. Okay, thank you. Now the floor is open for questions. So if anyone will have any questions for Dr. Siva or Dr. Iman, please feel free to ask.
I can ask a question. So well done. Nice presentations, very interesting content. As far as the assessment of kind of that IPEC competency structure. How many iterations have you done of that? Is this is basically kind of your pilot, or have you done it for several rounds of assessment?
This is a pilot for the students in the clinical. This is a pilot. It was done in one first round.
So have you learned things through that initial pilot that you plan to make changes moving forward?
So the learning for the positive, that this setting, we need to continue in implementing that to be transferred to a full clinical rotations part of our curriculum. The setting itself, the patient-centered students from different programs, this is the sound setting that we would like to do, or to do clinical rotations based on the sound theoretical framework. So this is the first thing, the framework. How to move forward? Yes, I would love to see the difference in structural design approach for doing that. We did the session with a minimum facilitation. We didn't do the discussion for the session. The students were completely learning with from each other and with the patient. There was no structure or formal structure talking about the clinical setting. If this will be conducted, I would see better to have address more of the knowledge base, since this is a clinical rotation. Now we need to gain more of the knowledge with the skills, the IPE skills. I would do some facilitation, like I will do this. We start with the briefing about meet the case, meet the patients, and then have a debriefing session with a facilitator, medicine pharmacist, with nurse, and then they revisit the patients there. We need a facilitator to be there to ensure the integration of knowledge. Now we did the IPE skill. We need more knowledge or clinical knowledge in this setting.
So what you're saying is that the pilot was very positive. You just need to expand the program more widely now. You've kind of justified the wider adoption of your program across your curriculum. Yeah, thanks.
Thank you, Dr. Tony. Any questions? Any other questions?
I have a question. Sousan Al-Muqdad. Thank you, Dr. Iman, for your excellent presentation. It was very informative. I have two questions, actually. The first one, why did you choose specifically the dialysis unit as a part of your setting? Does it have a specific advantages, or does interprofessional collaboration easily implemented there? And my second question, did you do any type of evaluation or assessment inside the clinical setting? I mean, apart from the questionnaire that you sent for students, were they assessed during the clinical rounds by the clinical practitioners inside the hospital? And thank you.
Thank you very much, Sousan, for really two good points. So the first one, why the dialysis? Since the first one, the setting itself in the hospital, where the type of the setting, there is a role for clinical pharmacists there are a role for the physician and the pharmacist, the type of the setting there. The second one, I'd like to start something where we can see actually the patients more than one time. So the dialysis, they are chronic patients. They are there during the dialysis. They can come regularly 2 times, 3 times in a week. So this was one of the things that when I was thinking of doing a design, I need to see measure the perception of the patients. So I need to be able to see the patients more than one time. So this is a second part. Of course, another concept is coming from the actual practice, that yes, there is interprofessional collaboration highly needed. The patients need this healthcare team in the care plan. And this is the setting that we want to see, or this is the practice need. So we want to learn the students and able to do that in the future. So this hopefully addresses your first point, while the dialysis, although it can be implemented in different programs, but this was the setting for the study itself to be feasible and able to do it. Regarding the second question, did I did any other assessment for the students? No, it was the survey, and this is needed. We need the skills of the IPE, not the cognitive part or not the knowledge. We just go through their perception, and this is the part of the study to see their self-evaluation of the IPE competency. And this is the change that I was telling Dr. Anthony. I hope to do it if we do it on the level of course, in a course level. I would add that. Thank you, Saz.
Excellent. I have a question for Dr. Siva. So Dr. Siva, for the validated questionnaire that you used, it was based on the health equity. Is it the perception of the students towards health equity? What about their perceptions about interprofessional learning? Was that also included?
Yes, out of the questions, we had divided that, like we will address health equity in relation to the interprofessional learning, how it's going to address. So we had these two themes as a main concept to include in the questions.
And did you use any kind of validated survey to measure the interprofessional learning, or the students' perception about interprofessional learning?
No, we just used this questionnaire, not no other surveys we had used.
Okay, so the survey mostly focused on health equity.
Health equity and interprofessional learning experiences in improving health inequity.
Very interesting. And did you, like when you were doing the team-based learning, did you refer to any kind of shared competencies, the IPE shared competencies that you wanted to ensure the students will be competent in after the activity?
When we had developed this focus group guide, we had the competencies listed, like all the 4 levels of competencies we made. So when we were analyzing, we did the pilot, and when we were analyzing it, we are just trying to put the phrases, whatever they had given, maybe based on the theme, what the statements has been given has been linked to the IPE themes, to which it may be the communication or the values which they show. We had tried to link it to the IPE themes which had come up with the post discussion.
Yeah. No, that's really interesting. And, for our ATPH conference, one of our sub-themes is focusing on embracing diversity, equity, inclusion, and belonging. So
I hope.
Yes, we're only 1 hour away from, United Arab Emirates. So
sure to be there with our results.
Yeah, it will be great to see the results at the conference.
Yeah.
Any other questions?
Sure to, Dr. Anthony, sure.
I have a question. Thank you both for your presentations. My first question is to Dr. Iman. You said something in your presentation. I saw something about feedback, and I was wondering, do the patients give feedback to the group as to how well they perceived they work together as a team? And do they get clinical facilitator feedback or a debriefing component with your study?
So thank you very much for your question. So its feedback was a part of the survey, 5-item survey. After at the last session, actually the students, it's as we mentioned, student 3 is a feedback and closure. So the patients were being asked a set of the 14-item questions in the 6 domain that I mentioned regarding the ability of the team. Are they helping me in medication knowledge, addressing my concern in these 6 domains? So the patients get a feedback, but in form of a structure survey. The IPE team were asking, and the patients will rate this from 1 to 5.
And my next question is to Dr. Silva. Do the students do peer evaluations to evaluate or give feedback as to how well their peers engage with one another when they're in a group?
No, like that was one of our agenda to include a peer feedback on this session. But unfortunately, due to time restrictions and ability to get them together, like we could not do that aspects of peer feedback.
Thank you.
Thank you, Dr. Stacy.
I have a question for Dr. Seva. Yes, it's very interesting project as usual. Doctor, I want to ask about the questionnaire. Is it about perception, like the students rate their perception, or there was an item about their knowledge they are gaining related to equity, and there was a knowledge-based question, or it's just like rating their perception? Or
We initially thought of going for a CAP project, knowledge, attitude, and practice. But knowing that we are going to administer these questionnaires across all the years from year 1 to 4, definitely the knowledge is going to be less for the year 1 students compared to the year 2. So we thought of generally putting up like the perception only. It's not the knowledge, it's only perception-based questions.
Clear. Yes.
Excellent. Thank you so much. Thank you, Dr. Siva, and thank you, Dr. Iman. Thank you so much for these excellent presentation. And thanks everyone who has attended. And thanks, Dr. Tony, for joining us from all the way from the United States. I know it's a very early morning for you, but really appreciate your support with this Interprofessional.Global Cafe. And I hope you will join us in future Interprofessional.Global. If you check the website, you will see these are on a monthly basis, and the presentation come from different regions around the globe. So do join us in these presentations and hear different perspectives and different experiences.
Thank you, Dr. Ella. Thank you, Dr. Anthony. Thank you.
Thank you.
Dr.
Nice work. Have a
Thank
wonderful
you very
day.
much. Thank you.
Thank you. And we hope to see you in Qatar in November, this November, for the LPH conference. Thank you.
Submit the abstract already.
Excellent.
See you then.
Bye-bye.
Thank you.
Bye.
Bye.